welcome everyone once again to this first Better eHealth webinar, which will be a first in a series of many over the course of this year. We're planning about to hold monthly webinars on a number of topics related to eHealth use, implementation, overall eHealth knowledge, to foster the wider spread implementation and use of eHealth on the African continent. Let me share the opening presentation and give you a little bit more background on this initiative, on this project. There it is. So specifically today, we're going to look at and talk a little bit about registries, repositories of technology, technologies, policies, strategies, and so on, and the value of such registries and how they can support eHealth planning, eHealth implementation, and as I said, the overall knowledge about eHealth technologies and policies. So welcome indeed actually to this Better eHealth online community to which you have all registered in the meantime, and which will indeed serve as, on the one hand, as a platform over which we will be hosting many more of these kinds of webinars throughout the next month, at least on a monthly basis. This is the first one after our initial event that we held in December 2021. You'll be obviously kept informed and invited each time to all of these webinars, but more than just let's say a webinar platform, this also serves as a meeting, networking, and matchmaking platform where you and anyone who is registered on the platform can sort of find out a little bit about who is doing what. There are possibilities to include additional information on this platform about what you're doing, maybe what you're offering in terms of technologies, or what you're looking for, or what your experiences are when it comes to eHealth policies and implementation. So this will definitely become a very important tool and platform in our Better eHealth activities, but also allowing you and all eHealth stakeholders across Africa, but also in connection with European partners and stakeholders to actually meet and get together. Just a few words and a background on Better eHealth for those of you who are not yet so familiar with this project. It's actually an EU-funded initiative which aims, on the one hand, to increase collaboration in eHealth, which we all know is a very important issue because eHealth involves so many different stakeholders. And on the other hand, it's also, of course, about informing the user communities, healthcare professionals, but also policymakers, government officials, and institutions who are dealing with the topic and the implementation of eHealth. Of course, all with the final aim of using or implementing eHealth tools to improve overall health, public health, and so on. And as I mentioned, it is very much looking at collaboration and exchanges within Africa, but also between Africa and European stakeholders, while at the same time we're obviously not excluding any other continents or potential contributors to these activities. These are the actual partners that are involved as direct partners into the project. So we have partners in Norway, Holland, Belgium on the European side, and then in Africa, in Tunisia, Ethiopia, Ghana, and Malawi. These are some of the very specific activities that the project is looking at, and very specifically for today, we'll really be concentrating on this topic of collecting and mapping resources, and then talking about registries, repositories, bringing together practical information that people can use, can learn from, in order to take a few steps at the same time, moving quicker and better forward, rather than having to invent or reinvent everything, again, as well as some of these other topics, which will definitely also come up in some of the following webinars. Again, here you can see a little bit the structure of the work that is being done and that will be done within the frame of the project. And again, today is really this topic that that we'll be focusing on. As mentioned, we do have partners in the project in these four countries that are indicated in red here on the map. And they basically each sort of try to cover, for these four regions within Africa, in terms of bringing together the stakeholders through online activities, through exchanges, but also through actual real life events, workshops, and so on. Again, to share knowledge and information, but also to learn from each other what is happening. And then, of course, we now have set up the online community, which, of course, is an additional support to these regional hubs to bring all the stakeholders also together through this online community, where we also have or will have the monthly webinar get-togethers. And then for today's agenda, as you will have seen, we do have four presentations as listed here. Actually, on the initial program for the Broadband Commission, we had Jason Chalabi from the Novartis Foundation, but unfortunately at the last moment he couldn't make it, but we're very fortunate and happy to have his colleague in this Broadband Commission working group on virtual health and care, Manu Tiwari from Accenture, who will also make a short presentation. So without further ado, I will now hand over first to Salim Azabi Zurak from the World Health Organization, who will tell us a little bit about their initiative with the Digital Health Atlas. So Salim, I hand over to you. Although I see on the list of participants now that he has logged out. He was in the meeting here. Maybe a temporary problem there. Let me just check quickly. Okay, well, while we wait that Salim jumps back into the meeting, I suggest that Manu, we indeed move ahead and give you the floor first with a little bit of an overview and some insights into the work that the Broadband Commission on Sustainable Development, and more specifically the Working Group on Virtual Health and Care, is currently conducting. Over to you, Manu.
Thank you, Frederick. I just try to share my screen because I was having some audio problems, so please allow me a moment.
Yeah, sure, no problem.
Just working now. Could you please load up the presentation that I shared with you, because I'm unable to share somehow.
Okay, yeah. Let me open it up right here. Okay. Oh,
Yeah, I think
it is
I
flowing now. Okay,
yeah.
perfect then.
Yeah, so thank you. Thank you for having us. My name is Manu. I'm part of the Accenture team that is partnering with the Broadband Commission, whose co-chairs are the World Health Organization and the Novartis Foundation for this year's working group on virtual health and care. So perhaps most of us know that the Broadband Commission is a UN organization, and it works through the ITU Secretariat. And it was initially established to promote broadband internationally and globally. And since the last few years, it has also taken up healthcare digitization as a focus area. And along with Novartis, it has released several thought pieces on policy recommendations, best practices around digitization of healthcare. So, for instance, in 2017 and 2018, the focus was on digital health, different aspects of digital health. And last year, the focus was on use of artificial intelligence in healthcare. And along those lines, this year, the focus is on working virtual health and care, whose motivation actually comes from our observation since the last couple of years along the lines of what is happening globally in wake of the COVID-19 pandemic. So what we are seeing is that countries worldwide are using several digital health solutions for managing population level as well as individual level uh, healthcare challenges, be it either through telehealth or through smart diagnostics or preventive health and monitoring. All these digital health solutions are helping overcome different areas of healthcare challenges, as well as we are all, I think, by now accustomed to the COVID-19 monitoring and tracing hacks, which are included within the ambit of population health, digital population health. And across all these different domains of healthcare, what we are seeing is an exponential increase in the use of digital health solutions. So this observation, uh, alongside some other observations on increasing access to healthcare and achieving healthcare equity through digital means and solutions. What you see here are some examples that we have uncovered on the use of digital health solutions in the last couple of years, how these solutions are helping bridge different dimensions of inequity. So inequity is not just about income, but it can also manifest itself in different forms, such as gender-based inequities. So what we are seeing is that, for instance, in Africa, in countries like Ghana, specific digital health solutions are being used to improve maternal health, as also in Uganda and in South Africa with the WHO-sponsored Family Connect and Mom Connect services. In case of disability, which also gives rise to some forms of inequities, we see that digital health solutions are helping overcome these aspects and helping the disabled integrate into the society. Some examples are from the Partners Health Plan in the US and the Sanat card in the UAE. And then, as I mentioned about traditional income inequities, we have instances in Kenya and Uganda where the smart health app was developed that could be run on low-cost devices, enabling the community health workers reach out to patients and reach out to people at the last mile. So altogether, this exponential rise in digital health solutions in the last couple of years, as well as their use and importance for achieving healthcare equity, is one major source of motivation for our work this year as part of the Broadband Commission. When we started looking at the use of these solutions in the last couple of years, what we found was that there was an inherent policy link, and we found that in several cases, if the governments took correct policy decisions, such solutions, the digital health aspects, were accepted by the society, and their use was more in those countries. So, for instance, in case of Germany, through their Digitale Versorgungsgesetz, this law, what they did was they made a policy on digital health apps, how they should be regulated. And as a result, several applications are now regulated. They can be prescribed by doctors to patients in Germany, and their use is now being promoted. Similarly, in case of India, data governance and implementation mechanisms were regulated clearly through definite policy actions. And we saw that their app for COVID tracing, Arogya Setu, it very quickly became one of the most downloaded apps in the world. On the other hand, in some other countries like Japan, what we have listed here, we found that correct decisions or concerns were not addressed at the right moment, and this introduced a lag in the uptake of these digital health solutions. Specifically in case of Japan, there were some concerns about liability and how the payments will be addressed if someone is using digital health, for instance, and they were not perhaps addressed on time. And that's why there was an initial lag in Japan in the uptake of these virtual health care solutions. Although recently they have made several policy changes and things are looking promising. This then brings me to the focus of this year's report, which is virtual health and care. And all throughout, if you would have noticed, the essential thread that binds some of these digital solutions is their remote nature, that they do not require a patient and a healthcare service provider to be in the same room at the same time. So this remote nature is the remote nature of delivering digital health. That's what we call virtual health and care, the delivery of health and care services remotely through digital means and technologies. That is our focus for this year's report, which also has an apt title of the future of virtual health and care, driving access and equity through inclusive policies. And as you are seeing now, we are focusing on virtual health, which is at the individual or population level, more towards the proactive and preventative health management side, as well as virtual care that includes the traditionally telehealth, but also now care navigation like the eTribe solutions, as well as smart diagnostics and digital therapeutics. And as I highlighted the policy link, so our main focus is how policies or policy decisions are shaping the uptake of virtual health and care globally, and what should be done from a policy perspective to further improve the uptake of virtual health and care and integrate it into the mainstream healthcare. In pursuit of this focus and this objective, we have looked at 23 countries, policies, recent policy developments in 23 countries across different income groups. And with the idea that to develop a framework of different policy elements that could help integrate virtual health and care into the mainstream. As a result of this exercise, this study of policies, we have come up with a virtual health and care policy framework, which is comprised of 15 essential policy elements that are grouped across 6 different policy groups for ease of understanding as well as for directed policy actions. I'll just highlight a few of these policy elements, which actually also link to the revolution that we are also witnessing these days, and that is more and more patient empowerment through the use of digital means and solutions. So in our framework, we have identified uh, aspects such as capacity building, human and equity-centric policy making, as well as collaboration as essential policy elements. In addition, we also have found that health outcomes, meaning that a given technology is actually or not for solving a given healthcare challenge, that should also be policy making and policy decisions for integrating virtual health and care. So altogether, our exercise of investigating these policies, these global policies in virtual health and care, has led up to this virtual health and care policy framework. And we are developing the report. The report will be released around May end. And with this, I would like to thank you and yeah, look forward to your comments and the discussion on our work. Thank you.
Thank you very much, Manu, for this overview of the current activities of the Broadband Commission's working group on virtual health and care. Yeah, a little part of the slides wasn't showing well on the screen, so there still is a bit of a glitch there, which we'll work on for next webinars. But as I mentioned, that we will to the participants, we will make them available so they can just have another closer look at this. In any case, again, thank you. This definitely is an important initiative and actually brings together quite a lot of stakeholders within the working group to bring together all this knowledge. You have already brought together, quite a few experiences on policies from various countries, but also looking more explicitly at specific solutions that have been implemented and so on. And that is exactly what we're talking about here today. Is there is so much information and experience out there. And so we have to find ways to bring this together in a proper way. Hence, various activities that are focusing on exactly on that same issue of the gathering and sharing the information. And so within BETTEReHEALTH, we also want to see how we can bring some of this together. I spoke before about avoiding to reinvent the wheel and so on. So all of our initiatives have to definitely try to align and collaborate where we can and exchange the information. Salim, yes, I think you were out of the call for a moment there, so we had immediately moved to Manu for the first presentation. No problem. So I will now give the floor to you so that you can present the digital health atlas and what you're doing. And there is definitely opportunity for questions from all of the participants. But I propose that we first go through the presentations and then at the end come to the questions and discussion.
Yeah, apologies. I had like a internet connection problem. So
no problem at all.
So yeah, just let me share my screen first, and then we go from there. Okay. Hope you see my screen properly. Let's see if like we have a proper
showing. We see the full slides. Thank you.
Okay, so who I am first, like, so I work for the World Health. My name is Salim Azabi. I work for the World Health Organization, and mainly I work for the Digital Health and Innovation Department. So it's a department like involved, with externally and internally with all like activities that are related to the digital and health at the same time, and innovation as well. So most important, like more specifically here is like I work for the capacity building and collaboration, mainly like why I'm here. Just to give you a little bit of overview, what we're trying to achieve is like, so vision and mission for us is to get like attain health for all, and then kind of like use the digital health transformations that are happening to accelerate this activity of like bringing health to everybody. And I think like a lot of us are like kind of like aligned with this mission, or trying to at least doing it visually, or like within their like area of like power, or area of like execution. So mainly the objective of our unit, which is like kind of like try to target the three levels of the organizations, means like member states from the global level, and the regional level, and like as well the country level. So mainly what we're focusing on is like implementing like new technologies, frontier technologies, and then like advocate for strengthening collaboration and engagement with different like entities to be able to kind of like accelerate like the executions of digital health like intake within countries, within our member states. So quickly here is like, this is like mainly our like three like like streams we're focusing on, and I think it's like a little bit repeating what we just talked about, which is like the capacity building. So bringing training to people, or to the different stakeholders, so they can kind of like bring in this new knowledge and execute like long-term change. Advocacy here is like, when we're going to talk about the advocacy part, we're trying to advocate for products that would like kind of allow or bring products to use for the member states, so they can allow like execution and collaboration to happen better and faster and more efficiently. And for sure, like the collaboration coordination, make sure that like we all collaborate together, and then coordinate like the executions we're doing. Like we can mention like what you're doing with the Better eHealth here, move like activity. There are others that are doing different activities as well, and we're trying to kind of like see if we can get everybody to kind of have like one mission and one vision together, and execute like one common goal, which is actually very often the case. So quickly, why I'm here today. I'm here today to kind of like let you more like bring knowledge about the Digital Health Atlas and what it is. Digital Health Atlas is a product that's actually like, first like maybe starts with like why the Digital Health Atlas is here. So the problem that we all like I think agree on is like there is lots of like digital health like activities happening within the countries currently. They're like all siloed. Sometimes they happen like without like in a silo like execution, where nobody knows about them. They are uncoordinated because like donors come, they like invest in one thing, and actually it's already existing. So there is lots of like duplication. There is inflexibility that's like more about like strategically. Sometimes like some digital health investments are done without looking at the ecosystem, and then see like what could be like the best option to execute, like making sure that there is interoperability between the systems, making sure that like we have like return on investment that is higher than what like just the product is doing, but like to look at like the higher like a picture. So yeah, common goal, mainly like we have this kind of like three stakeholders that we're focusing on: government officials, implementers, investors, and donors. And they're all actually trying to do the same thing, more or less, to achieve better health for everyone, everywhere, empowered by digital. The only thing is like, they, as mentioned before, they're not connected. They don't talk to each other. They don't have the same information. Uh, they process information differently. They have different like languages. Uh, they don't have a common like model to understand the data that is coming. And they're interested in part of the data, not all the data, depending on who you are. So yeah, that's number one. So from the jungle, as I mentioned before, where we have like all the digital health products that are like actually like executed, like kind of like invested on, within the regions, within the countries, within like even specific like local areas and others. We're trying to kind of like make sure that like there is a good return on investment for all the stakeholders that we see here. And bring in like kind of like a better return on investment, as I mentioned. So there is a need, and the Digital Health Atlas is trying to solve this need, which is like to plan and coordinate, all the, to support the governance mechanisms in all investments, so people know about each other. There is transparency, there is knowledge acquired, and more, and then like as well to monitor, to be able to monitor what's happening, where we are at, or what happened to those products that were like implemented 2 years ago or 3 years ago. Are we like moving ahead? Are we like slow in execution and other things? So yeah, so mainly, as I said before, there is lots of activities happening all over the world. Everybody's like seeing that this is important, that like we need to move from this like unstructured data or unstructured like information that we have about like the digital health investments that are like everywhere, within governments, within like donors, kind of like spread data everywhere about like what's happening and what is the real like the real actual like footprint, or like the real time footprint coming from here. So we want to move from there, and the digital health atlas trying to move from there to the structured data, where we have a common language, common data model. And I will talk about the 5 V's related to more like a big data, but I think it's something we all need to work on uh, later. So yeah, talking about the 5 V's. So what we need to do here is like in our case, and we're trying to do to bring in like more amount, like the amount of data needs to be produced is high. We need to bring in more data about the investments. We need to have a better velocity in a way to speed up like the collection of data, and that it's kind of like a real time that we can, take better insights from the data. The variety of data, like to look for varied sources, as I said, like there's different stakeholders, and then bring it together. There's the veracity and the validity of data is important for us, like to ensure that like the quality of the data that we bring in about the projects, investments, and others are like credible, that they are collected properly, that we have the latest information, that we have the information that we can take decision against. So that's important. And then last but not least is like value. So the information, all these information that we are collecting or we are bringing together, just collecting is not enough. It's not like collecting data is great, but you need to bring value from the data that you're using. So that's like one of like the aspects we need to focus on as a, like community, and this is something that is important for us. So yeah, the why of the of the Digital Health Atlas. So I'm gonna repeat myself, but I prefer to repeat myself so it like make sure that like everybody understands it the same way. So being the most important is like that we more aware of like the investment current footprint, and then make sure that like we all know what's happening, all over the world, regionally or like locally, uh, to allow us to analyze current landscape and provide with actionable insights, so that we can say, okay, what kind of investments I need to do, now, or what could be like the options I have, on my table right now to be able to be more efficient, or to kind of like have better impact. As well, combining like multiple data sources, bringing data sources and data information from different like points of views. Like as I mentioned, like there is the stakeholders, but there are more than that. Sorry, I just went. And then at the end, like the most important part is take better decisions. So we need to make sure that like people take decisions that are related to data, data driven decisions. They're like more accurate, they're more like impactful. They make you to like learn faster, they make you learn like make you execute faster, execute like with knowledge, and not execute like in a random like random way, and then like learn from the random like execution, and then redo the job several times. So yeah, so it's why we have the digital health atlas. So sorry, I've been talking about like the whys and the reasons and the what's we're trying to do, and but like just let's make sure we go through like what is the digital health atlas. So for the moment, it's a repository of like that is a global digital good that's provided by WHO to all the community within the Ministry of Health, or anywhere like all our member states, where people can like kind of like register their products, so people can get aware about like what's happening, so people can like all what I mentioned before here. It's something we want to kind of like create like a community of like data sharing and information sharing, that is key for decision making and for different actors, and definitely like the same actors we have here that we are targeting, at least in Digital Health Atlas, which are the investors, the donors, like the government as well, to take decisions on what they do, what they could do, and the implementers as well to know what's happening on their like like area of like execution, see like if there is any synergies they could create with other implementers and so on. So that's the idea behind the platform. And just coming soon, as I said, data is not enough. Collecting data is not enough. We need to create like information. We need to create knowledge, and I would explain more that here is like, so just we bring in like a kind of like a platform, like a kind of like a sibling platform together with the Digital Health Atlas. That is storage.digitalhealthatlas.org, where we analyze the data, where we give the opportunity to the community to kind of like analyze the data, and then provide with insights, because this is the most important part, this knowledge that is like brought to life, for others to be able to see, okay, what are, for example, here, just a quick example that is like, okay, what is like the most widely like, adopted within Africa and Asia, like a product or these kind of things, and then maybe try to, say if like we can use it or reuse it, or do we need to kind of like invest in more on the other products and other things. Simple example here, number of projects that are in place, how many people are reached, how many health workers are reached, how many field facilities are reached. So this kind of information is important for us to be able to see what are the impact we're having, and then to kind of like monitor it. One other thing that is important for us is, as I said, from unstructured to structured. So we use like to kind of like categorize the data. We use like kind of like a guideline provided by WHO, which is classification of digital health intervention, the version 1.0, and then we believe that like kind of like using this taxonomy would allow people to kind of like talk the same language, where we're able to kind of like see, for example, here like we're analyzing the number of challenges that are like, what are the challenges that are like pursued by the different projects, and then focalize, like after you can more give this information to decision makers, that in a way that they can understand it, in a way that they can like act on it, and not like be like too technical. Or so there is different layers on the way of classifying that helps like everybody to talk more or less the same language here. And then one thing, as I said, like we have data, we need to move to information and then move to knowledge. And this is like the way we see the Digital Health Atlas like role, that we don't keep to collecting just data for collecting it, for the sake of collecting it. Bringing information is like bringing like simple statistics or these kind of things. Knowledge is even higher, where we can like bring in like real information that exactly reflect the reality, of what's happening exactly, and then we go for better decisions. I think there is one other step that we will go for, is the wisdom, but I don't think we should like reach that yet. But if we arrive to the knowledge, that would be good, and the knowledge that is like shared by the global community, that's what we're trying to achieve here. So yeah, just to let you know, what we do in here is not only us. There is lots of actors, as mentioned. There is a lot of donors, other donors, or other like entities, governments that are involved, or like implementers and others, and it's something we need to do all together. So yeah, that's my my pitch for you to kind of like embrace the DHA. My pitch for you to bring like what is done currently with the Better eHealth, or with the initiative you like running right now, to bring it like to something that is sustainable in the long term. And then yeah, that's from my side. Just in case, so if you want to contact us, digital health, digital-health-atlas@who.int, and we go from there. Maybe like just to before I finish, I would love to be more specific, so we don't. I will share another screen quickly, if I can. Let me take the right window. Sorry, 2 seconds. We do the entire screen. Oops, we're having a problem. Just so I need to stop sharing here.
Yeah, one thing I found, Salim, if you want to share, you have to make sure that the screen is already
Open, yeah,
maximized and open
yeah.
in the background, and then you can select it.
Okay, let me open it first because it wasn't showing. There we go. You're right. Yeah, to be more specific, so this is the Digital Health Atlas, as you see here. So a map first, for sure, as like we do in like kind of like a geolocalization of like all the projects, where you can kind of zoom in onto what's happening in different countries. You can go as far as you can. Then you can select, like countries and say, okay, this is what's happening here, relating to which topic and other things. Like we do have some stats on the projects. What are the health focus categories that are mainly like executed against, or like kind of like tackled, on the standards that are used, that can be used for interoperability, and other things that like to what we should focus on. There is as well, so as I mentioned, like the projects you can just create, as I said, like as a donor, as an implementer, rather, you just go and enter the data, where we have 3 sections: the implementation part, the stages, where are you at, are you advanced, are you just in the idea, are you in the scaling up, the technologies in use, and the interoperability like aspects. So yeah, that's just to give you like a quick overview of the product. As I mentioned before, we are using this classification. So the classification of digital health intervention version 1.0, which is like kind of classify and categorize like the digital health investment according to these categories, which is like the client and the health provider, health system managers, data services, bringing the challenges, bringing like different aspects that could be like allow you to analyze. And then just to finish, and I think like if you go to the Digital Health Atlas, I will drop like a YouTube, so you can have a look at like an overview quickly, it on the chat. But just to let like the idea behind is like to get analysis on what's happening and who are the top donors and what they focus on. That can be useful for implementers, can be useful for everybody to know like which ones I target and this kind of things, as well, like for example, like as I said, the stories about like the platforms that are in use, what are the areas of focus, what are the project stages where we are at, and this kind of and all of that. So this is what we're trying to bring, is like this knowledge that makes you allows every entity to bring in the decision making like power. So yeah, that's it from my side, and like I'll let it open for questions.
Okay, thank you very much, Salim. Well, very much like the point around knowledge, getting from data and information to knowledge, and maybe ultimately wisdom, and also of course the value. This is also why we had set this specific meeting and webinar up, was to look at the value, because it's good to bring information together, but it needs to be used, and it needs to be useful and valuable for the people and the stakeholders out in the field. So we'll definitely want some input and feedback from all of you on this. I'll just move forward now with a short presentation from my side about the BETTEReHEALTH initiative in terms of registry. And then we'll still have a presentation as well from a more local, national level from a representative from the Ethiopian Ministry of Health. And then after that, we can get into a more open discussion and take on board all your questions and input. So let me go here and share this. So at the very beginning of this session, I told you already a little bit about BETTEReHEALTH background. It's the fact that it's an EU-funded project with European and African partners, really looking at improving or boosting the eHealth knowledge and the implementation, ultimately, of course, to create better health conditions, health environment, public health, and so on. I'm a partner in this project through my company in Belgium, but I'm also involved in the International Society for Telemedicine and eHealth, which is a network of global network of telemedicine, eHealth, digital health stakeholders. Now at BETTEReHEALTH, we have indeed set up now a registry, which is actually available under the link that you see here. And it's a registry that focuses both on solutions, so actual technology, programs, applications, and so on, but also on policies, policy documents, strategies, and so on, which indeed we want to bring together in the same sense as the Digital Health Atlas is also doing, in order to provide, on the one hand, an overview of what is there, so that the stakeholders, the healthcare providers, healthcare professionals, governments, and so on in the field can know what is already there, and then maybe take the bits and pieces that are useful or relevant to them, and also use them or implement or start working with some of these solutions, or take inspiration from a number of policies that have been implemented in other places and have shown to be working well. But the project itself is a coordination and support action. So what we really also want to do is support what is already out there in terms of maybe more local and national initiatives in bringing information together, but also working together with and then ultimately feeding into things like the Digital Health Atlas, because I mentioned before, we definitely don't want to go into just another parallel track where we're doing the same thing as others are doing. So the work that is done here is basically something that can help to generate even more input, bringing more information together around solutions, around policies, and then ultimately, which we are already doing, is align things and feed things into the Digital Health Atlas. And in that sense, we have also already, in terms of structuring the information, we're also working with the same and similar classifications to which Salim was already referring to. So there is ongoing collaboration and exchange at that level already, but we know, and then we also still discover many more new initiatives to which we want to, or with which we want to link up, collaborate, and ultimately, try and bring as much of that information together in a central repository, or make it available in one way or another through, let's say, one entry point. So, as I mentioned, it's both on solutions and on policies and then official documents. Now, we did already start filling in and entering a number of data at this point, mainly through the 4 partner countries that are a direct partner in BETTEReHEALTH. Things are at this moment very much in a draft status and still being reviewed. Also, coming back to what Salim was saying about the validity, etc., of data, because it needs to be data that are correct and that are also useful and relevant for its final purposes. We're also going to open this up for let's say public submissions, so that it's not only our small group that would be entering information and data into this registry, but where we can also accept and receive information submissions from others, of course, while at the same time that information will then still undergo, let's say, a review before it's ultimately published. So that's in a nutshell, and we have some of our partners here today as well who are even more actively working on this, both in the back end in terms of the database and information structure, but also in the front end, if I can call it that way, to gather the information and to get more people involved in data entering and submission. And this will indeed be something that all along the coming months will continue to work on. So by the end of this year and into early next year, this registry will certainly bring together quite a lot of information. But as I mentioned, in collaboration and looking at further sustainability, not to let this just sit there on its own, but rather be integrated with other initiatives. I just wanted to mention this as well when it comes to repositories. There was already some work done several years ago through an innovation working group, which was a UN initiative. And there was this specific task force on a global knowledge commons for M and eHealth innovation, which did not bring together the actual solutions and policies and so on, but rather which was looking at or proposing steps to be taken in the methodology to be followed and so on, to bring together that useful and relevant information that I was talking about before. We actually have this document available on the website of the International Society for Telemedicine and eHealth. And as you can see, the idea was indeed to look at or bring together a database of projects, products, services, looking at who is who, finding out who is doing what, and from there, of course, being able to identify potential relevant partners or people and organizations to work with. And bringing that, together in all these different formats, whether it's articles, video material, papers, publications, and so on. So just something to show that, yes, this idea and this will to put in place such kind of repositories and registries has been around for a long time, but there still is work to be done to put it in place. But we see with Digital Health Atlas and with some of the work that we're doing in BETTEReHEALTH that things are definitely coming into, let's say, more practical and concrete phases now where this information is brought together. Another example of this, also within the frame of the International Society for Telemedicine and eHealth, was a knowledge resources database that actually was put together within the frame of an annual event, but that stopped taking place in 2017. But where repositories were made available of presentations, publications that were made at this event, categorized under a wide variety of topics. So also that, we know that there's many other events and initiatives that bring such information together. So those are also some of the places where all of us need to go and look or try to filter out relevant resources, relevant information that can be shared through such repositories. I just want to mention this because incidentally, early next week, there is that international conference of the International Society for Telemedicine together with MENA Telehealth. So these are always opportunities to put that exchange and learning into practice. And there is an initiative from the actual organizers of the event to also set something up in terms of a collection of video material, publications from such conferences, but also even more widely. So again, a similar initiative, and then we'll definitely be looking at how we can bring this together with all of the things that we are doing. So with that, I'll finish my presentation just to say that we definitely hope to continue to connect with all of you through this online community, where we will have more webinars coming up in the next months, but it also is a community where you can individually and bilaterally with other participants connect and actually even meet online at any given time. So that's it from my side, and then I'll hand over immediately to our colleague from Ethiopia to make your presentation on the inventory that you have put together with digital health projects and applications. And after that, we get to the discussion part and all of your questions. So, David, can you share your screen? I see you are unmuted, but we can't hear you for the moment. You're quiet. The sound is very low. We see your screen in the meantime, so that was perfect. But no sound from your side for the moment. Still nothing. We do see your screen, but no sound. We could hear you just before that. And I see you're logged in a second time now, but there you're muted. Can you unmute that? If it does not work for the moment, maybe try to disconnect entirely and then come back in. Maybe in the meantime, we can take some questions or feedback or hear about other initiatives which some of you are involved in or doing, or also hearing from you what is what. And now I think now you're coming through, David.
Okay, can you hear? Hello?
Yeah, say yes, hello. It was okay
Hello?
at the very beginning of the meeting. Right now, yes, now we hear you.
Can you hear me now?
Yes, I think you can go ahead, but still
Okay,
need
let me share my screen.
Yeah. Okay, perfect.
I don't know the screen.
Hello again, David. Is it working to share the screen? Because right now we're not seeing it. Okay, there it is. And now we need you to unmute again. I see that your microphone is still muted, so if you can unmute that one, then you should be all set. David? Okay. No, it was fine just before we saw the presentation, but we're still not hearing you at this moment. Your microphone is not on.
Hello,
Yes,
can you hear me?
this is fine. The sound is fine, and now the
Let me share
screen
my screen.
sharing.
Okay, let me go ahead.
Yeah, please
So,
go ahead.
shall I continue?
Yeah, yes, please.
Yeah, sorry for the technical difficulty. So,
Yeah.
my name is David. I am from Ethiopia, Ministry of Health, Health Information Technology Directorate. So, my presentation outline looks like this. I'll start with a brief introduction, and then we'll look into the Ethiopian Digital Health Project Repository System and its alignment with the Ethiopian Health Architecture. And then I will talk about the current status of the Digital Health Project Inventory System and the activities we have performed so far. And at the end, I'll talk about the challenges and the opportunities we have in terms of our endeavor.
Yeah,
So,
sorry, I'm just intervening. Yeah, if you because at certain moments the sound is a bit faint, it goes away, and maybe make sure to talk
also,
well and into the mic.
okay, so how's it
Yeah,
now?
this is
Okay,
much,
I'll,
yeah, much
I,
louder.
I'll
Great,
do, okay,
thank
let
you.
me do this. So, as a starter, let me talk about Ethiopia. So, my country is found in the east of Africa with an area of more than 1 million square kilometers. And currently, we have more than 12 regions and 2 city administrations. And it's the second most populous nation in Africa with more than 100 million population. And as you might know, we have our own calendar and our own alphabet. So, as you might know, the Ministry of Health of Ethiopia has been implementing various digital health systems so far, and these applications are aimed at serving clients, providers, facility managers, and the likes. And even though we have this kind of systems for the last 10 years, we didn't have a mechanism to properly manage these vital health information systems. And as a result, we were facing challenges like we couldn't properly manage these information systems, or we cannot coordinate various stakeholders working on the sector. And we cannot strategically align the digital investment with the sector's strategic plans. As you know, digital health has to be aligned with the sector's strategic plans, and without having proper management of digital investment, we couldn't align the digital health investment with the sector's plan. And as you might know, most of the health information systems in Ethiopia are owned by projects or partners, And without having a proper management system, we cannot institutionalize this information system once the projects are over and the period is done. And we couldn't also avoid duplication of efforts. Various projects come and they work on duplication of ideas and duplication of information systems. It could have been avoided if you have a system which inform new entrants what kind of information systems are on there and where are the areas we want support. So as a result of not having systematic management of information systems, we're facing this kind of challenges. So as part of governance mechanisms, the ministry was developing various governance tools. And one of the governance tools was the Ethiopian health architecture. So the Ethiopian health architecture is a framework which shows the various health information systems in the sector and how are they interacting towards an objective set by the sector. And it also serves as a guidance document how different digital projects should be aligned, how the investment should be done. And with adherence to the eHealth architecture, we set as objective will benefit in terms of strategic investment in digital health, in collaborating various stakeholders in the sector. And also, we could avoid a duplication of effort, as I told you previously. One of the challenges we have in the sector is that we have so many partners coming in, and they unnecessarily duplicate their workers. So this is the Ethiopian health architecture, and it's like that. And we try to categorize the different information systems as, for instance, as shared services, which can serve for other information systems. We have institution-based health information systems like the health management information systems and the likes. And we have also the population-based information systems like the vitality registries, the census, and we have also analytics and business intelligence information systems like the data warehouse, data analytic platforms. And as the middle, you can see we have the interoperability layer where we want to make the different information systems interoperable so that data collected by one health information system should be easily available to other information systems. For that, we need to have an interoperability service layer which makes talks the different health information systems. And there at the bottom, we have the point of service health information systems like the AMR, the patient portals, the community-based information systems, the ECHIS. And we have also the government's document, as I told you, the standards and the likes, which enable the different information systems talk to each other. And also, we have external information systems. As you know, health is not an isolated system. It has to various institutions. So, information coming from education sector, from agriculture sector, and meteorology has come and there is a system so that it will be interoperable with the other systems. So it will plug into the interoperability service with the other information systems and data coming from external sources. So as the Ethiopian health architecture, we have done an application inventory so that we know what we have in hand before we dive into digital health information systems. So you can take it as house clearing work. So we did that with the objective of identifying the various health information systems in the country. And by doing so, we can guide the future investments and what can we do in the future. And we can also see how they can be aligned with Ethiopian health architecture because the health architecture is a master plan. You can call it as a master plan of the digital health investment. So the various health information systems should be aligned with the Ethiopian architecture. So when we do the inventory, we can easily align with the Ethiopian health architecture. And also, we can do, at the end of the day, we have to make interoperability information system. So how can we share data and what are the challenges in order to make this information system interoperable? So with that objective, we did an app inventory, I think, in 2018. And based on that, we have registered more than 200 health information systems throughout the country. This inventory is done in all the regions, federal agencies, World Health Office, and private institutions. So among the more than 200 health information systems we managed to inventor, we found almost 77 of them are unique. The other health information systems are overlapping. So as I told you previously, one of the challenges we were facing is that we have so much duplication of efforts. So this is visible from the inventory we did. And we have tried with app inventory, we have tried to categorize the information systems like the intervention areas, their geographic distribution, ownership, the technology used. So these are vital informations for starting the digital health information system registering as an information resource. So as part of the app inventory, my colleague from WHO has already shown you the WHO Digital Health Atlas. So in collaboration with WHO, we have tried to push our health information systems to the WHO Digital Health Atlas. It is now publicly available. It looks like this. So the informations, the digital health information systems we collected have been pushed to the WHO Digital Health Atlas, and it's now visible to the global community, and it's accessible on the WHO Digital Health Atlas. So coming to the digital health project inventory system, as I told you, we have tried to develop a software system, and we implemented that the MOH. It's developed by the ministry itself in collaboration with a university, and it's now deployed at the MOH premises. And with that, we are now registering various digital health projects. And also, besides, in addition to registering the information systems, we're also collecting the resources along with various digital projects like the source codes, the project documents, the requirement documentation. These are all the resources we collect along with the vital information we collect from the projects. So by doing so, we are trying to identify what kind of digital tools we have. As I told you, the digital information systems could be for clients, for providers, or for facility managers. So what kind of information systems do we have on the right now? So we are trying to identify that. And also, we try to see the spatial distribution of these information systems. As I told you, we have a big country with more than 12 regions. So what is their traffic distribution? Where are they concentrated? Obviously, most of the digital information systems are in the urban area. So we will see how they are distributed and what was their intended purpose. When they originally come to the country, they have their intended purpose. Are they serving that purpose still now, or are they not achieving their intended purpose? And also, what we want to know is the technology they are using. Most of the projects are donor driven, as you know. They bring multiple type of technologies, and having to know what kind of technologies is very important for their sustainability, because the human capacity has to be there from our side to sustain these systems, and knowing the technologies they are using is very vital for us. And also, we want to register with our digital project information systems, the organizations that were involved during the development and implementation of these systems, and also how is it aligned with the Ethiopian architecture. As I told you, the Ethiopian architecture is our master plan, which guides digital investment in the sector, and the various information systems coming into the sector has to be aligned with the Ethiopian architecture. So one of the criteria we are trying to look into this information system is, where are they falling? Are they the point of service information systems? Are they falling into the shared health records? Or are they falling into the analytics and knowledge discovery areas? So the drivers or the motivations that we have when we develop this inventory system is that first we want to make the registration and certification process very transparent. The one thing maybe I didn't mention to you is that along with registering the information systems, we are planning to provide certificate of recognition for information systems which fulfill the criteria we set on the inventory system. So we set mandatory data elements which has to be available to be registered on the health information platform. And then if they fulfill all that criteria and we have the necessary resources like the source codes and the project documents, we'll provide some certification of recognition. By that, we mean that the health information system is now valid and the ministry is provided recognition for that health information system. And anyone coming to the sector or the Ethiopian digital platform, they can see which are the information systems on the arena and what are the information system already provided recognition by the ministry. This is very important for the project owners or for anyone involved on this kind of activity. And also, one of the motivating item is that we wanted to align this information system with Ethiopian health architecture. Previously, the information system are coming and they are not aligned with the Ethiopian health architecture. We want to make sure that it has to be aligned with this architecture. And also, the other driving factor is that stakeholder integration, harmonization. As I told you, there is a disparate information systems with poor integration, and also information sharing among the different stakeholders is very poor. With having such kind of system in place, we can make information sharing very easy, and also data exchange is also one of the targets where we are trying to achieve. So the major activities we did so far in terms of our initiative is that we have developed the application, we have tested it, and it's deployed as a much the ministry data center. It's available now. It's accessible globally. You can access it. I will provide you the URL later. And also we have tried to produce a governance document. As you know, this kind of systems has to have a governance mechanism. Unless otherwise we have that kind of governance mechanism, their sustainability will be at stake. So we are trying to produce that governance document and share it to all stakeholders which are concerned with this platform. And as such, as of today, we have more than 80 systems registered on the platform, and we are trying to collect all the necessary information come along with these information systems that are registered, but the information we require from them is still ongoing. And as part of the digital registry platform, we are requiring them to push the source code of the different information system to our own configured GitLab. We have a GitLab resource configured at the ministerial premises. So any digital project along with necessary resources have to push the source code to our GitLab resource configured at the ministry. So they are mandatory to push the source code if they are to be provided recognition by the ministry. So here is the tool. This is a screenshot I took from the digital project inventory system. You can access it through the URL, dhpi.moh.gov.tt. It's publicly available. You can register on it, and if you have any important system, you can register it on it, and from our side, it will be available for verification and for consequent steps. So as you can see, at glance, we have tried.
Move on.
Hello?
Yeah, it's fine. Go ahead. Yeah.
Okay. Okay. I'm coming to the point. So, by registering the information system on digital project inventory system, we have to categorize the information, an information system.
Yeah, sorry, David. The sound is very
How's
faint
it
again.
now? How's
Yeah,
it now?
that's better. That's better.
So, once it is registered on the platform, it will be automatically categorized based on information provided by the person who registered that particular information system. Be automatically categorized, or whether it is a shared service or whether it is shared the information system, or it is for standards analytics and business intelligence system. So, as I told you, one of the driving force we have to develop some kind of platform is categorize information systems in alignment with better. So information systems registered on the inventory platform categorized based on the header mechanism, and are doing that, and you can see we have the numbers, how many systems are falling there. So whenever we add any system on the platform, will be categorized with categorization. And you can also see that at the top, we have tried to adopt the WHO classification. So along with the classification, we have tried to incorporate our own additional needs. So WHO classification of that projects are there, and also in addition to that, we have incorporated our own additional data elements. So this is how the new digital projects are registered. The information is stated, the implementation areas, the technologies that are used, the standards and qualities there. These are all information that are gathering when we register from the system in our platform. So coming to my final slide, these are the challenges and the opportunities we have here. If I start with opportunities, we have the management buy-in among all stakeholders, start from management. We have a consensus that this kind of information platform is very vital, and we have the green light from every stakeholder when they share this idea. And also, we have developed the tool in our hand, so it's owned by the ministry, so that's the plus for us. And also, global expert is there. One of the tools we have learned from is the WHO Digital Atlas. So such kind of tools are very vital for us. As I told you previously, we try to build up a WHO Digital Atlas and also incorporate our own needs. And when I go to challenges, one of the challenges we are facing is that, as you know, many digital information systems come to any country with poor documentation, so we cannot find the even project proposal documents.
David, make sure to speak closely into the mic, please.
Okay, sorry. So one of the challenges we are facing is that lack of documentation among the platform we have currently in the country. We can't get the project proposal document, we cannot get the source documents, the source codes. This is one of the challenges we are facing currently. And also, we don't have currently the governance mechanism on the certification process of platforms. So we are trying to develop that one, but currently there is no such governance on how certify for the system, what are the criteria to certify certain information system, be it health or any kind of information system. This is one of the challenge. Also, the other challenge we are facing is that the lack of ownership. We can find owns this kind of platforms. You can find many health information systems in the sector, but who is owning them? Many of the partners who were working these projects, either they abandoned the project or the project has been phased out, and we cannot get enough information about it. So even if we have this kind of challenges, we are trying to in our side, and I hope we materialize our endeavor and learn from our partners as well. Thank you for your attention.
Thank you very much, David. Yes, we were losing you a little bit at the end there. The sound wasn't perfect, but thank you for the overview. Yeah, I have again noted some of the information that you were saying about this information, and this app inventory has to sort of guide future investments, guide decision making. So it comes back to the value of bringing the information together, setting up these repositories or inventories of existing solutions, which I think is a message we've heard all throughout. Now I've seen that, Salim, you were still with us, but I think you have to go into another meeting quite soon. So just want to give you the opportunity to make any final comment from your side. At least we will still continue with the meeting then, unless you can stay on board for longer.
I would stay for like maybe 10 minutes more, just
okay.
to keep it interesting. So maybe one thing to mention is, like, I think we're talking all the same language.
Mm-hmm.
It would be good that, like, we start to do initiatives that are global, that are like, you know, kind of like were visible to everybody, that are transparent to everybody. WHO is here as, like, you know, like everybody knows WHO, everybody, like, so putting repositories that are kind of like just held by small entities won't like make a difference. And we are here for this kind of like spreading the information. So it would be good that we replicate information that you already have, or create bridges where the information is already brought. And I'm happy that Ethiopia is bringing this information, but let's see if we can bring something that is sustainable for the long term, not only like within one scope of a project or two, but in a long term where actually we all have this information. That's it from my side, but I'm much more interested to hear about feedback from others that are listening to this all these presentations.
Mm-hmm. Okay, thank you very much. Well, we did have a specific question or two even in the chat already from Jay Ganesh, which was more directed to our colleague from Ethiopia. Maybe you want to come in. Feel free, Jay, if you want to take the floor and just have that exchange with David, or else I can put the question to him. Yeah. Okay. Well, let me put it to you, David, and then I see that Kostas also wants to come in, so I'll give the floor to you right after that. David, there was a question there what related to the leadership and governance structure for eHealth in Ethiopia, and then also whether there is a program management unit dedicated to eHealth within the Ministry of Health in Ethiopia. This, of course, is very much on the topic of how things are structured in Ethiopia. But do you have any, and you can read the questions in the chat window as well, David, do you have any input on that?
Yeah, sure. Can you hear me?
Yeah.
Great. So, yeah, nice question. So one of the challenges, as I mentioned, is the governance structure. Yeah, as a ministerial level, there is information erosion, which is led by the ministerial level. So down there we have different hierarchy for information erosion, one of the of the education plan. There is an information erosion governance overall system. So that's what we have currently. In my view, that's not next. It's not fully running, so it's there. We can see its effectiveness. It's force from the health.
Yeah, David, sorry to intervene again. The sound is a bit broken, so it's not so clear. We can't fully understand what you're saying. Maybe it's best, I don't know, to log out and in again, or else exchange also directly with Jay on this topic, or in writing over the chat, or even use the online community platform to exchange. So sorry to interrupt you, but it was quite impossible to fully hear what you were saying. Okay, so for the moment we can come back to that, but I also suggest a direct exchange between the two of you, and then Kostas, you have a question you mentioned.
Thank you. Okay. It was a very interesting webinar and very interesting presentations, and thank you also, Frederick, for organizing it. My question is related to also what we heard from David, that they developed their own app inventory, based also on the discussion we had earlier today with the Ministry of Health of Malawi. But also maybe we have also some questions from Ghana Health Service here. That I see that there are like in our partner countries, there are similar initiatives as in Ethiopia to develop registries or inventories or collect information about eHealth solutions in the country. I also would like to ask all of you and also Salim if you see it as a trend that more and more countries have this need, and also if there is a way to make this work easier for each of the countries. I see that there are different levels of collecting information. We all need the digital health atlas, because it's also the place where we can use it as a repository and update the information and get information for other countries. But the local registries, if I understand correctly, they serve more the needs of the country with different fields that are relevant for each Ministry of Health or the stakeholders in the country. So if you have any comment on that, that will be very interesting. I also have colleagues here from HIS Malawi that might also have, there's also a comment here.
So I think I'm Maganizo Monawe from HIS Malawi. I also work for the Ministry of Health. I think just to add or extend to Costa's question, I think it's just a comment. The experiences looks very similar, like what we have in Malawi and the presentation from Ethiopia. I think like us, we have done inventories like for the last maybe 2-3 years. First, we did for mobile applications. We had so many of them. Most recently, we have done for most of the EMRs, and we also have so many of them. So the experiences are the same. We have tried to look at the governance processes, like how to manage building architectures, like interoperability frameworks. So it looks like we have similar experiences, and I think maybe we can hear from the other countries and their experiences, but I think it looks like that's what we have. And I think it's interesting to see what opportunities, like what the Digital Health Atlas is able to provide. Also, what the BETTEReHEALTH inventory platform is providing. And I have seen, I was trying to summarize like the gaps, looking at both the Digital Health Atlas, the BETTEReHEALTH inventory, and the Ethiopian. I have liked the feature of uploading source code for the platforms into the Ethiopian inventory. And I've also liked the feature of uploading policies, strategies, and other important documents in the BETTEReHEALTH platform. So I think just to add on the experiences.
Okay, yeah, thank you both for these, let's say, insights and sort of needs, and showing that, it also has a value for you, and it is interesting to have access to that information from other countries, other regions, and how it is done there, and what you can take away from that for your own purposes, for your own national or regional health systems, and so on. So I think it just adds to the fact that yes, there is a value to be created through such registries, as long as the information is well structured, well validated, and so forth, and easily accessible in a way that you can use it. Again, there was even some more questions around whether there is a specific directorate for digital health activities in Ethiopia. So David, there's a few people, Sam Kwarshi from Ghana, Jay Ganesh, who are definitely interested in hearing more from you. Maybe you can connect with them also offline or later on, or as we said, through this BETTEReHEALTH online community where you can exchange messages with all the registered participants. Also, Marlon, Ralph, you had a question or a few questions. Can we hear from you now?
So my first question is to Asabi. regarding the Digital Health Atlas. First, I would say I agree with his initial comments about some need for there to be collaboration amongst all these various registries. Because even citing an example from his presentation, there seems to also now be a jungle of registries. Even last year, I was involved in a consultancy where I was doing a mapping exercise, so essentially coming up with another registry of its own. So there is need for collaboration that's there. The question now for the Digital Health Atlas is regarding entries that get on there. Are these only entries that are reported by government or ministries of health? Because I'm from Zimbabwe and I looked at it and I only saw very few initiatives that are linked to the government, but nothing from the private sector. Is there room for private sector entries? And importantly, from a private sector point of view, what would be the benefit for an entrepreneur to ensure that their initiative is on the DHA?
Yeah, let me answer to that, and thank you for the question. So mainly, like anybody, as I said, there's three actors here that we are like focusing on. So the donors, the governments, and like implementers. And the implementers means like private sector, anybody who's like involved in implementing the products. So yes, you do have a value for that. The value is like that you landscape. First of all, you will get people to know about you. That's number one. So there is a promotion. Second, you make sure that like you know what others are doing, so you can find like interoperabilities with other private sector like players that are doing the same thing, or see how we could like engage with them and make sure you do like something that is like good for the ecosystem. And the last but not least is like as I said, you get people get to know about you. So the governments, when they do any strategies or these kind of things, they would say, okay, there is this platform that is already in place, can we leverage it or not? Can we use it or not? So the things like the digital atlas is like not only, I want to mention one thing, like everybody thinks that like it's only WHO that needs to work on it. It's everybody. We need to all work on it. We need to all put resources to put like information in there. We need to all make sure that we like have like consistency in our like bringing data into the platform. And this is like a community work, and it's like it's a global good for everybody. So we bring in like this like enabler, and we're trying to create like we need to create the ecosystem that like makes this enabler useful. Otherwise, it's just an empty shell. And yeah, sure, like the data is growing, and as I said, like we need to work on the 5 V's. So the velocity of data so far is not really good in some countries because of different aspects, because lots of people don't think that it's important. And moreover, when the start of the data entry is like when you start to have just a little bit of like data set, it doesn't make any value at the beginning, but more the data set is going to grow, more it's going to make value. So I think we need to work together into bringing this insight. So for example, I don't know what Ethiopia did, bring in stories about like what's the information provided with, like what kind of this information, how can we make it like an information and the knowledge. So bring in a story about like what's by analyzing the data, what do we get from it, and what can we bring to the donors, what can we bring to the others to understand about our situation, so they get better decision making. So I think it's like there is lots of advocacy that we need to do all together at the same time. That's on my side.
Thank you, Asabi. I then had also a question for Frederick. Thank you, and just it'll be good if things mature towards sourcing funding, particularly for people that are in the private sector. But I know we'll get there. Thank you very much. So for Frederick, it's a question relating to BETTEReHEALTH, the BETTEReHEALTH initiative. I noticed that the website is .eu. And I appreciate the history, why it is like that. But just to ask, has there been any efforts to maybe integrate or collaborate or work with the African Union? I know before it wasn't maybe an intentional body for digital health within the African Union, but I think something has been set up as recently, maybe as last year. So is there are there any plans to then, whether it's transference or a collaboration with the AU?
Yes. Well, yeah, the project itself is an EU-funded initiative under one of the funding programs and calls that was issued, and of course is also part of a larger set of initiatives and projects that are related to EU and Africa collaboration and involvement. But obviously we want and we need to indeed connect, and the primary focus of the project is basically on Africa and what is happening there, and hence let's say the four partners, African partners who are directly involved as a partner in the project, obviously have an important role to play there. Some of them, like the Ghana Health Service, is let's say coming from the policy side and the government side. But we need to also, and we are involving others through these regional eHealth hubs that the African partners are sort of managing, and where they bring together stakeholders from the region. So yes, links with what is happening within, let's say, the structure of the African Union also have to be grasped by us, but there is work to be done, and well, thank you for making that comment and yeah, even that suggestion. So any input like this, and then certainly also any contacts that you and others can bring in are more than welcome, because we know from all of us, all the activities that we do and that we have, that there is so much going on and so many things involved. And again, that's where the networking and aligning certain efforts and making sure that we know who is who and who is doing what is taking place. And that's where also, again, these registries come into place, because they are the place where everyone sort of can find out what is happening. But as we also just heard also from you, there is more information that needs to get into these registries, into the digital health atlas, so that it gradually grows into such a who is who reference site or resource, where you can really find most anything that is happening. So yes, in short, we are looking into what is happening, let's say, at the level of the African Union and some other initiatives, but to be worked out further, for sure. And yeah, I'm just going to jump ahead, because I see a few others. Sam Quarshi, you would like to bring in a comment? Sam, are you there? Or he had written in the chat, I think. Yes.
Thank you. Thank you very much, Frederick, for the great session. From the Ghana perspective, the eHealth inventory compilation has been triggered by the government Cyber Security Act. The National Cyber Security Act identified healthcare institutions as critical information infrastructure. So it became imperative for healthcare, the Ministry of Health, to have a list of all digital health interventions in the country. Now, this is because of increase in cyber attacks against healthcare institutions and health data, and of course, the need to address data privacy, integrity, and availability. So we are now focusing and making sure we know what is in the ecosystem, and the interventions that we know that exist, what are their vulnerabilities and threats, and what we need to do about it. But what I think Ethiopia have done that is fantastic is they seem to have a working governance structure that is tracking what intervention is in the country, the processes you must go through before you start a digital health intervention. So I think the project closure stages, and that is what I believe is missing in Ghana, because we have to kind of go on a shopping amongst all the healthcare institutions to identify which interventions are currently operational and functional. The COVID-19 pandemic also kind of exposed the enormous potential technology offers in addressing the COVID issue. So then we also started asking ourselves, what kind of application do we have currently that can be leveraged to do contact tracing and also case management of COVID-19 diseases? So all these together has heightened the need to make sure countries have a working inventory management system for tracking and digital health activities. And I thought I should share this perspective to the participants. So thank you, Frederick.
Thank you, Sam. Chipo from Malawi, you have a question or a comment?
And thanks for the presentation, which actually highlights the presence of the three different systems, which are quite similar in a way. For my question, I'll use the analogy which was used by Salim, where we're coming from a jungle and going into a garden. My question is, how are these three systems, BETTEReHEALTH, Digital Health Atlas, and then the Ethiopia system, plus the country assessments that are taking place, are they taking note of who is visiting these gardens to assess the impact of the systems which have been made available to policymakers and different users? And if not, meaning will be concentrating more on the volume. In my opinion, we've done quite well where data collection is concerned, but beyond that, I think we still have to do a lot of work to ensure that there is that impact we're looking for, so that we get to the human factors, technical factors, and public policy factors. So if we're not concentrating more on this, we may end up creating yet another jungle, this time volume jungle, whereby we'll have lots and lots of data, but then the impact of having that data may not be equivalent to the amount of data we collect. Thank you.
Well, thank you for that intervention, because I think what you mentioned comes back again to the value. It's good to have a lot of information, which I was hinting at before. Growing these repositories, but in the end, yes, it has to be well structured, and it has to be accessible and structured in a way that you and others can use it for their own purpose, and to sort of find out or select a proper or an appropriate solution, to sort of look at a specific policy or a strategy, which you could translate or transpose into your own setting, whether that is at a national government level or something more regionally or within an institution, and so on. And that's indeed still one of the exercises to be done, and to make sure that, yes, we bring together through these different initiatives, which at one point or another definitely have to integrate or be more closely aligned, so that it can become useful. I mean, that's what I think, and that's what we'll also be working on within BETTEReHEALTH. But happy to hear any further inputs from some of our other colleagues who are in this webinar. So feel free to intervene. I think there were still a few others here on the list, but feel free to open your mic and come in with your own question, or maybe with an answer to what or insight into what Chipo was saying, or any of us, or any of the other ones.
I have a question.
Yes, go ahead.
This is Flora from the University of Oslo. Good presentation, David. You know, getting organizations or different systems in a country. Can you hear me?
Yes, we hear you.
Getting organizations or different systems in a country to share information or to collaborate, it's a very big problem. And I see from the presentations and the experiences from Ethiopia, they're doing a very great job. So my question to David is, what are some of the lessons that we other countries can learn in the sense that they've been able to get different systems to share information or exchange information? Thank you.
Yeah, I would like to sort of open up the floor. I don't know, or if Kostas, if you have any specific input on that, or if anyone else would like to come in with some thoughts.
Hello. Hello.
Yes. Hello, Etienne.
Hello. Well, one of the answers is to share software component in open source and to reuse, to take care that the developments are really reused in other countries. You may, of course, need additional things in function of the local culture, but the core work of healthcare is at the end very similar. You need a lab, you need image, you need a problem list, and so on. Thank you.
Okay, thank you for that suggestion and idea, Flora. I'm not sure if that is answers at least in some way your question or provides useful information, or if you were looking for still for other types of input. In any case, and I think we'll gradually round up this session. As we mentioned earlier on, this online community has now just started up, and so the aim is really to continuously grow it so people can continue to sign up, and through that platform connect and network and meet at any given time with each other, and it, in a way, it also already serves a bit to bring together information about who is who and who is doing what. But then we also have regular webinars on a few different topics. There are already 2 in the pipeline, which we'll announce very shortly, but then more are coming up throughout the rest of the year. So keep an eye out for those. We will definitely, for some of these webinars, also be looking for contributions and input from all of you and many other stakeholders. So there are opportunities either through presentations or through participating in discussions and debates to share your own knowledge and information, which then again will be a useful resource in itself for others to learn from and to take away useful and relevant information. With that, I will conclude this webinar. I thank you all for joining us. It was, I think we have definitely taken up and taken on board a few new ideas, a few new comments and questions, which will be part of our work within BETTEReHEALTH. So keep a lookout for upcoming messages from our side, requests for information and input, but also invitation and announcements for future webinars and events. So with that, thank you again, and we look forward to seeing and hearing you again soon.